France and South Korea have also got evacuation plans.
But you need to prepare for and assume
strongly warning Americans to avoid all non-essential travel to China.
That this is going to be a real serious problem.
France, Australia, Canada, the US, Singapore, Cambodia, Vietnam, the list goes on.
Health officials are investigating more than 100 possible cases in the US.
Germany, a man has contracted the virus.
The epidemic is a demon, and we cannot let this demon hide.
Japan, where a bus driver contracted the virus.
Coronavirus has killed more than 100 people there and infected more than 4,500.
We have to prepare for the worst, always, because if you don't and the worst happens.
War Room Pandemic. Here's your host, Stephen K. Bannon.
Live from Capitol Hill, it is Friday, the 17th of April, the year of our Lord 2020. You're in the War Room. War Room Pandemic, live from the John Fredericks Radio Network on America's Voice.news, the streaming service of the Trump Revolution. That is now Dish Channel 219. And you can get start-to-finish coverage of the president's daily briefings about the CCP virus. Also on Newsmax TV later in the evening, now on 70 million homes, FM 99.1, 103.9 in Chicago and throughout the world on nexus.org, IRRS. And later in the day, subtitled in Mandarin on Radio Free China as we blow through the firewall to get to all the Lao Beijing, old 100 names in China, as part of our movement to help the Chinese people get their freedom. On G News and GTV. Want to get to a lot of things today. By the way, I told you there was some confusion earlier about this number of deaths, and I think so the deaths. Tolls, let's get right into it. We got Jack Maxey, Jason Miller, Raheem Kassam here today. A lot to go through. The president announces the reopening of the country. We're going to get to that, the rolling reopen. We are proud to announce that the Chinese Communist Party has gone back and rethought their numbers in Wuhan. Just 48 hours after we announced our Saturday second descent into hell, Xi's death sentence to Wuhan. Right, 48 hours later, they changed the numbers. And the reason we're doing the special this week is we're very dialed in to the people of Wuhan. They had actually come to us and wanted to do a special. So as we told you 2 days ago, we're going to have people from Wuhan, people from mainland China that are there. And they had told us in advance that the Chinese Communist Party has lied about everything. And this doubling of the number they've got is just a drop in the bucket about the lies they've told. So Saturday, tomorrow, 10 a.m. to noon, on all of our distribution platforms, and now over 6 million downloads of our podcast, hottest podcast in the country. We're going to do Descent into Hell Part 2, Xi's death sentence to Wuhan. You're going to get all the up close and personal, the tragedy, the agony of the people in Wuhan that were the first war victims of the Chinese Communist Party, the people in Italy being the second, and then the United States and others being third. But we're going to get into all of that. We're going to talk in hour two, have Lou Dobbs commenting last night on war with China, and get to all of it. I want to talk first off deaths, the numbers, because the president laid out, Dr. Birx, Ambassador Colonel Dr. Birx, laid out a criteria, right? And I noticed Fauci was quite quiet yesterday. He was like a sidebar. I don't know if it was because of Raheem's beatdown on his Tinder grinder comments, or he was just off to the side. But he wasn't a main player yesterday in the historic day when President Trump said, "Hey, here's what we're going to do."
Well, I mean, part of it is because there was an actual plan that was put out there. There were actual goals and strategies, and Dr. Fauci is really good at talking about moving goalposts, and as I said yesterday, kind of Dr. Gobbledygook as far as moving things around. But when it's really hey, you got a paper due. At a certain point, you got to go and hand it to the professor. The professor is either going to give you a grade, or they're going to be like, where's your paper? And Fauci's always kind of like, oh, well, look, I was on my way here, and the dog ate it. And it's always a moving goalpost. And so Dr. Birx is one who actually had to put pen to paper and present a plan. So
let's talk about, there's a change in the numbers overnight. And this gets to this, the Wall Street Journal is reporting, and I think the Washington Post reporting, and it kind of spiked up early this morning, reporting over 4,000 deaths in the United States. The number I thought I was looking at early AM was 2,300, which is still bad. The last 4 days, and I think it has surprised people, that number is not decelerating like they thought. So we've had 4 days over 2,000 and close to 2,500. But the spike up, the 4,000, was And I guess the reason nobody really knows, Johns Hopkins is reporting this now up on their site, and then other people are picking it up. But it looks like it's this controversy between, and I don't think it's much of a controversy because I just don't think you ought to do it, between the probable deaths and the actual deaths. And the difference here is that where they tested for COVID-19, for CCP virus, either on their death certificate or some sort of mechanism as the coroner does this, and that's that extra jack. I guess it's 2,000 deaths that they're principally in New York City that they're talking about, that de Blasio is talking about.
Well, I mean, this is an issue, and I think particularly in a place like New York City, there could be some budgetary issues associated with this, because if somebody is designated to have died of COVID-19, then the Fed is the backstop.
But also, too, and CNN did a package on this yesterday, where they went through, and especially in the lower income communities where folks might not have the health care coverage, or they're concerned about the cost and going, maybe they're older, maybe they already have one or two or several comorbidities that are going on, people die at home. And as they're going back through and determining what exactly it was, they're finding a lot of cases it was the coronavirus that put it over the top and actually took their life.
This is where it gets it gets foggy, and we have expected something like this. We've been told for a couple of days that numbers, especially of people who have been dying at home, and it's not been a hospitalized death, would be added. And this is how the revisions of the Wuhan numbers are still a massive understatement of what's happened here, because if we are going back and saying, okay, over the last week, 2 weeks, whatever it is, we have 2,000 more deaths to add, and we're just going to lump it all onto this one day, which was overnight today, then imagine what's been taking place in places like Wuhan, where you had the original outbreak, you had the cover-up of the numbers, you had the cover-up of the transmissions, all of that. Those numbers in Wuhan are still rubbish. But here's where it gets foggy for us, because how many times are we now going to have additions on the day when actually they could have happened 2 weeks ago? It actually will confuse a lot of the numbers and confuse the modeling. The Washington study puts us at around 2,400 a day. Now, if you add these numbers in, it's going to cause a major differentiation in the way the chart looks, and those charts are informing policy. Those charts are informing the markets, they're informing policy, and if we just simply have a methodology where we're lumping all these deaths onto one day, that's a problem.
Okay, I want to get into this. This is important because about the reopen. The reopen is going to have this gating event that has a certain set of mathematics to it. That kind of, and by the way, the president has kind of said it's not like because it's just recommendations. It's not like saying you can't start the process, but this is kind of the recommendations to get you to the starting line. The key to that, I think, is the one I've been talking about: the percentage of increase in testing versus increase in cases. Right, that delta. Right, particularly if you're seeing drop, it knows that you're kind of on the glide slope down.
Particularly if they said if you were doing a constant number of testing,
yes,
and or an accelerating number of testing, and you are seeing
a constant acceleration.
Right. So that you can see that the total number of new cases compared to the total number of tests is declining.
So this gets back to the set of metrics. This is why I do think the White House would have been better served actually coming out with more definitive and defined set of metrics in every phase, right? Here's the metrics you should be looking at. To get back to the deaths, one of the things that's been concerning people now is like the situation in the New Jersey nursing home, where all of a sudden you see 17 bodies just stacked up in a place they're supposed to, they got room, I think, for 2 or 3. It's been a very legitimate thing in New York City from the beginning, just given the lack of personnel. Normally 20 people a day on average die in their homes in New York City. There have been 200 dying a day since the crisis has started.
Well, what's interesting about that is de Blasio has made that statement, and he's never actually given a number. It's always like, we have 100, 200.
Well, no, I think they did sum up that number. That's the probables. I think that's the aggregate of the probables, right? So my point is that that's fine and good, but that should be adjudicated. I agree with you. You can't lump all those in at one time. I don't even think you go back and prorate them. Because you could go back to the 20 a day. They've got the records of who died, right? I think you got to set that aside, and that's going to be worked on for another time, because this set of metrics, and the one that is the most disturbing, at least right now, is what I call the Plateau Effect, right? And I think that various people, and I'm not saying at the White House, but I think various people were doing modeling that showed a quite dramatic drop, right, in the deaths, right? That would have made for a more aggressive opening. And you just haven't seen that. Right now, you've got this plateau factor, and you have, as Greg Mann's pointed out this morning, is going through it, you have certain areas like Massachusetts and others that are coming up that are now challenging places like Detroit and others. So we're not seeing that. Even the slope, remember, we're saying on the slope, and I had that great article in Bloomberg, hey, what did you really do for slowing the spread, right? Instead of going after and trying to smash the virus, did slowing the spread really accomplish? How much did it really accomplish?
Well, I want to play for a moment. I want to play Dr. Sanjay Gupta and his
We're
comments.
doing this all as constructive observations because our feeling is that we wanted to go harder on this and then harder out, right? So, with this mass on point. And I think you're seeing now you've kind of devolved it to these governors, and who knows what the plan is.
Right. So here's, and again, when we talk about the plan, there's this intro phase, these gating procedures, which we're going to get into in a moment, and then we get into the actual phases. Here's Sanjay Gupta talking about that.
All the things that should have been happening all along certainly should have happened at the beginning. We're now talking about as this gating criteria or triggers to basically come out the backside of this curve. I think the way John King framed it is right. I mean, everyone is sort of focused on the reopening. What's America going to look like during these various phases? But these are significant criteria. So even if symptoms of influenza-like illness are coming down over 14 days, and even if actual cases are coming down over 14 days, there still has to be testing in place.
So that's Dr. Sanjay Gupta last night.
And he was given the White House to this. I agree with their gating event, right?
Yes. So one of the things, and I want to go right to the actual slides in the presentation that Dr. Birx had yesterday.
Very important.
So it's the guidelines for opening up America.
And make sure for our radio audience, too, I want to make sure we walk through the details of this, right? So everybody's listening. They can't see, but is listening to go through this.
Right. So one of the things Dr. Birx started with was a 3-part slide. It has the entire country with the headline, Influenza-like Illness Activity Level Indicator. They had for the week ending March 28th, the week ending April 4th, and then the week ending April 11th. I will be honest with you, I was a little confused as I was seeing these slides, and I'll tell you why. First of all, just even talk about the influenza-like illness activity level indicator is a little different from cases or deaths of COVID-19.
This is exactly right. They start off with one that kind of chop blocked me coming off the line.
So I'm watching this on TV, and I start going online. I'm like, wait, what am I missing? Am I, are we talking about the right thing? Are we doing different comparisons? But here's the thing that jumps out. And again, a lot of our data and metrics have been driven by Dr. Chris Murray at the IHME, University of Washington, the Murray model, the much maligned Murray model, as everyone from left and the right is pummeling it. But, and again, not that he's the gospel, but it's a set of metrics since we haven't seen those from the White House. As you look through these 3 weeks, these 3 charts, the first week ending March 28th, there's red all over the place. That's bad. Like that's in the bad zone. Then by the time you get to the week ending April 11th, I mean, almost the entire country is in minimal. I mean, literally Florida is in like the next to the lowest possible. I thought Miami was a hot spot. You have all these retirement homes. Texas, even California is down in the minimal zone. The only places where there's a very high activity level are the tri-state area, Massachusetts, Maryland and D.C., Louisiana, which we've talked about quite a bit.
New Orleans.
And then South Carolina. And then in Puerto Rico is in a kind of
thank you, JFK.
Right, but the thing is, so if you're looking at this map, the clear take, and this is, it basically says, hey, open up all of the entire country except for the tri-state area and these couple of outlier states. That's the very clear message that is sent with this map. But again, the activity level, and they have like 8 or 9 different kind of color-coded things. But if you look at it, it's almost the entire country is green, with the impression there being, go ahead and just open it all up. Right. Is just as a passive viewer, that would be the clear takeaway. And then they go into the phasing. Before we even go anywhere, is that, and I know we have to jump for the break here, is that really where we are as a country, that it's the tri-state area, the D.C., Maryland area, Louisiana, and everyone else is fine?
One tweet before the break, guys, keep being aggressive. Someone has to. Raheem loved the tie. The rest of you guys, do you think you can just slum it?
Today.
This is slumming it? Come on. It's only a 2-pin day. Come on.
Been up since 5:30 going through all the news. I didn't have time to put on a suit.
Such a tough crowd. Okay, the War Room. We're going to return. # War Room Pandemic. We want to hear all your comments, observation. We'll return in a moment.
War Room Pandemic with Stephen K. Bannon.
The epidemic is a demon, and we cannot let this demon hide.
War Room Pandemic. Here's your host, Stephen K. Bannon.
Okay, welcome back to the War Room, episode 124. If you're listening on podcast, I want to turn back to, by the way, we're not here to entertain you today. This is a serious one we're going to go through, or they're all serious. This is very serious because we've had 4 days now in a row of just horrific deaths in the country, this mass casualty event. And the President of the United States is now determined to reopen the country in some sort of organized process. He has essentially pushed it back to the states who did the lockdowns to do the opens, but it's in the analysis yesterday in the presentation that you get to see where the direction of the thinking and how realistic this is. Jack, just one thing before. This is why we kept saying you need to socialize the nomenclature and the ideas. To drop out is the very first thing you had, influenza-like symptoms. It's like, whoa, I thought we were here with CCP virus, right? We've been talking CCP virus. In fact, we didn't want to confuse the two because I keep saying nobody dies of the flu, but now they've opened it up. Is that because of a testing why that jumps off the page at you? Why did they do that?
Well, I think what was interesting is they've been doing this influenza tracking for decades now in the U.S. So they have a system in place for it. So local doctor in Des Moines says, I've got somebody with influenza, check, number, no, goes on the list. But what is ironic to me is we're talking about COVID-19 and they give us the influenza map. Now, this shows me that they don't really have their hands around the testing to be able to give us a map that defines.
Why does it show you that?
So I want to take us back to the interview we had with Mayor Giuliani, and in the actually we had him on those 2 Saturdays in a row where he talked about, and we really want to get into this as kind of the most recent American crises or disaster-like situation, the horrible terrorist attacks of 9/11, which by the way was in 2001. Joe Biden last night he stumbled, he couldn't remember what year 9/11 was, but we'll talk about that in the second hour. But what Rudy talked about was how in every day they would come out there and they would just start restating the facts. And they would say, today, here are the stats, here are the things. If I were running again, I'm putting on my comms hat for a moment here. I would going back a month and a half ago, and they started doing all these press conferences, I guess about a month maybe, seems like a number of years. I would have just started off these things listing off the statistics, starting it off with charts. You start socializing and normalizing. Yes. Here are the updates. So then when you present a chart, so for example, yesterday wasn't the day to me to put out a slide or slides titled influenza-like illness because that's a new variable.
Yeah, it's a new term.
It's a new term. People are trying to wrap their heads around it. But you want to have the consistent baseline to inform voters in the media and the markets every single day.
Exactly. So let's go back to, so we now know it's probably because of testing, right? That they've got a system for one. The other system's kind of catch or catch can.
I want to correct a little bit what I said. Obviously, we don't have the actual specific numbers for every state for the COVID-19, but the influenza tracking should still theoretically give us a pretty good idea of where people are showing up at their GPs with influenza, COVID-like symptoms. Now, one thing I do find very interesting is that they would sort of throw it all together in a big block. Influenza-like symptoms. Remember, this wasn't supposed to be the flu.
No, that's
but now
the bifurcation
they're just
of that.
Tossing it together.
Yeah, that confused right at the get-go.
Yeah, I mean, right there. I mean, influenza-like illness. I mean, that's like when our man Raheem was down for the count for a couple of weeks. I mean, do we? But you're
on the bill he's not going to pay.
Exactly. Yeah, we'll just send that to Boris. Let's before we dive back into the chart again. Let's go ahead and play 2 very brief clips from the press conference, the president and then Dr. Birx. They're both short clips.
We're establishing clear scientific metric and benchmarks on testing, new case growth and hospital capacity that must be met before advancing to each phase. And that's each phase specifically in the reopening of our country.
And then here's Dr. Birx.
Before you go there, though, it must be met. I don't see any enforcement mechanism of that whatever. It's essentially guidance. We're recommending it be met. It's not a must. Somebody who wrote that for him said must be met. Like your overall, you've essentially put out the guidance, particularly for the gating, and then you've got kind of benchmarks for each phase. But there's no enforcement mechanism. You've essentially devolved it back to the governors. Hey, you guys locked it down. You guys are going to open it up. Remember, We're the logistics and cash portion of this at the federal level. The management's the governor's level. The really execution is at the county supervisor and mayor level. They're bought into that paradigm, but there's no enforcement mechanism. I thought it must be met.
Well, and I think, look, the president also continued and said the governor should call their own shots when it comes to this. If whoever was writing that speech and putting it together needed to make it very clear that what I'm asking is that all governors ensure that these are being met before you start moving into any of the phases.
Exactly.
But that needs to be spelled out, because when the president says it, it sounds as though it's the federal mandate.
He ought to redo that today.
Yes.
I think this in this whole rollout, and I think part of this every day, now that we kind of, hey, look, we haven't got our hands totally around this. There's not a definition of mass on point, which we talked about. But this thing's going to kind of go forward. Every day at this press conference, to me, should now be broken out as that, okay, here's the open. Here's where we go. And that ought to be cleaned up today.
Yeah. And then here is Dr. Birx.
Have to go through those gating criteria related to 14 days of decreasing evidence of illness and decreasing testing despite adequate testing.
Okay, so this is the point while we're watching the press conference where I start texting Steve, being like, did you understand what that meant? We usually kind of have. So actually, I want to play
Did you ever have the lecturer at college that you would sit there and they would lecture and you have no earthly idea? For the few classes I showed up to, that you would have no earthly idea what they got. And everybody in the class was kind of nodding. The mainstream media kind of nods along like they get it, but you're sitting there going, hey, I thought I understood this. I have no earthly idea what she's talking about.
I want to play this one more time. It's a 9-second clip.
Yes.
And the reason being is because, look, we've played Sanjay Gupta saying that these initial criteria,
yes,
the gating criteria before we get to the phases, is very good. That's from CNN, Sanjay Gupta. That's not from War Room or Breitbart or Daily Caller. Right. That's Sanjay Gupta saying it. Okay, so we're all there. Before we can get, we obviously played but what the liberal media is jumping on today, what they're driving is, and even a lot of the CEOs, it all goes back to testing.
Yes.
They want to go and kind of move the goalposts onto that. And they might not be entirely wrong. Let's play Dr. Birx one more time.
You have to go through those gating criteria related to 14 days of decreasing evidence of illness and decreasing testing despite adequate testing.
She missed. It was decreasing it's cases versus testing. She stumbled over the word.
Okay.
Just go back and play one more time. This is the thing. Remember, one of the key benchmarks we've talked about, and Gupta got it, was the ratio between increasing test and decreasing number of cases. That delta, that spread shows you're on a curve that's not going to get into the ICUs.
Or even
like
if
that.
all things are basic, say we're doing 10,000 tests a day in New York, and for 3 weeks we've been showing up with, I think it's about 50%. This is of people who are sick.
Let's do something better. Go back to the presentation. You have symptoms and then you have cases. Go to the middle column.
Yep.
It goes something or. What's the
Okay.
what's the
so
bottom?
what we're telling folks initially in this, the way that the slide presentation opened up, we had 3 slides on 3 different weeks, and they had them they're like 9 or 10 categories and kind of the heat zones. And again, it's the visual for the passive viewer. You're going to look and say, other than the tri-state area of Maryland, Louisiana, Puerto Rico, the rest of the country is green or some version of green, i.e. the implication being open up. Then it goes into the actual gating criteria. By gating, it means the benchmarks that have to be met before you start opening up into these
the triggers.
Right. And yesterday we talked about a red, yellow, green.
Yes.
So instead of red, yellow, green, it's 1, 2, 3. Same concept we were talking about yesterday. Exactly. So the gating criteria is split out into 3 parts: symptoms, cases, hospitals. So these are what you have to go through. So symptoms, downward trajectory of influenza-like illnesses reported within a 14-day period, and downward trajectory of COVID-like syndromic cases reported within a 14-day period. Okay? So that's the symptoms.
Yep.
Cases, downward trajectory of documented cases within a 14-day period.
Yep.
And the downward trajectory of positive tests is a percent of total tests.
This is the key stat.
Within a 14-day period.
Read that one again.
Okay.
This is the one I look at every morning because this is the key. Read that stat again. That's
downward trajectory of positive tests is a percent of total tests within a 14-day period.
Yes. You track that every day.
Okay. That's the biggie. The third part in this, the gating criteria, treat all patients without crisis care and the ability to treat all patients without crisis care, and robust testing program in place for at-risk healthcare workers, including emerging antibody testing.
That's a big. That third one is kind of like you're assuming a can opener with opening the can, right? I mean, that's something that's kind of slid in there, and you go, well, hang on, if I got that, that's my mass on point. I'm not so sure we're going to have that. The antibody test is up in the air, and they're talking about 20 million a month by the end of May. End of May, I think it is. Vice President Pence says we'll have 20 million tests total ready to go, right, on antibody testing.
And they say that we could potentially be doing 1 million tests a week at that point.
And I guess they're saying for health, this is for frontline. This is for the guys crossing the beach at Normandy. This is equivalent of the PPE. You're doing this on the testing basis for the tip of the spear.
One thing she did say, though, in the press conference was that it's going to be on the part of the feds to make sure that these states and local communities have the testing capability to actually track what's going on in their community. And that's something where we have to step forward. The antibody testing is very interesting to me because we're now finding out that the tests aren't very good.
Well, no, that's the point. But they must have known that before they put it in.
And this goes back to Joe Norman's interview yesterday, where he talked about the variables, what you can measure, what you can't measure. Symptoms, okay, we can measure this. Cases, okay, we see how we can measure this. Benchmarks, metrics. This hospitals, that infrastructure, the strain on the infrastructure. This is the big unknown, guys. This is why the markets in the left of center media, this is what they're focusing on exclusively today.
But hang on. This is, by the way, hashtag war room pandemic. We're going to take a break here in a second. But here's the key point. The infrastructure we initially said were ICU units, bed capacity, ventilators. Now it's really down to technicians and doctor nurses. Units are part of the infrastructure. It's defined as infrastructure. Short commercial break. Return in a moment.
War Room Pandemic with Stephen K. Bannon.
The epidemic is a demon, and we cannot let this demon hide.
War Room Pandemic. Here's your host, Stephen K. Bannon.
Friday, the 17th of April, the year of our Lord 2020. You're in the Capitol Hill, the nation's capital, the United States of the Federal Reserve. We'll get to all that later. Actually, market's up today because of the good news on certain of therapeutics. Want to go back to the founders set this up that the states would be laboratories of innovation, right? Be laboratories of innovation. I think we're about to see that. I think we're about to get a big civics lesson because I think you're going to have different personalities, different folks doing different things. Some are going to be very aggressive and some are going to slow walk, right?
Yeah, and folks at home or at work might be listening and wondering, hey, what why are you walking through this? Why are you what's the buildup? And I want to make sure people don't get lost in kind of in the weeds here, because ultimately this is going to result in a lot of governors making subjective decisions, and in particular the ramifications for 2020 that if you have Democratic governors in certain states decide to sit on things. I'm just throwing this out, pure speculation. If Wisconsin, very important state, you have Governor Evers there, who's a Democrat. If he were to decide to come out and say, no, we're going to keep everything closed through September, no colleges, no schools in the fall, no University of Wisconsin-Madison football going on, how does the public then react, and who do they blame, and the finger pointing? This is why the subjective decentralization, the federalist approach here, these are what some of the ramifications could be. Again, Governor Evers has not said that. He's not hinted that. I'm just using that as an example of some of the unintended consequences of how this could play out. So let's go back to the chart, Steve. Again,
because this is going to have a direct impact on your life. The way this rolls back out is the way we kind of get. They're going to dovetail the economic. The pandemic triggered an economic crisis that triggered a financial crisis. We're working through that bridging mechanism on the economic crisis. Are we talking about another package? They're talking about this huge fight they're having over expanding the PPP program. All of that. It's going to get down to, obviously the president's made a decision. Hey, the states rolled in and locked this thing up on a case by case basis. I'm going to put some criteria out and we're going to unlock it the same way. Some are going to be more aggressive. Some are going to do it the way they're going to do it.
One thing that's good about this, and you said a civics lesson. For example, we've spent the last 2 months essentially criticizing the nation at large, criticizing the federal response. But the reality is there's also going to be a little report card on the response by these various states, because according to the plan, I know I get ripped for saying the national pandemic plan, They all should have been prepared on their own. There was no mechanism for the federal government to come save you. And now you look at a place like California, they've got extra ventilators. New York, by their own decision, written and signed by the governor and Zucker, they decided not to prepare.
So in these influenza-like illness activity level indicator charts by week, again, there were March 28th, which was flu season week 13, April 4th, flu season week 14, and then April 11th, again, flu season week 15. The reason why I highlighted Wisconsin, just an example, they're a state that for that week of March 28th, they were in the high category. There's a very high, moderate, low, and minimal. And each of those have 3 different color shades in there. Then you go to that week of April 4th, and Wisconsin improves slightly to high. They're still in the high as of April 11th. They're surrounded, which as much as we've talked about Detroit's in a low. Actually, are they in is it low or minimal? It looks like it's actually in a minimal. The way so they're in a minimal, which we talked about Detroit being a real bad place as far as it blowing up. Even you take a look at Chicago, they're in a moderate. So Wisconsin, which we have not, I don't remember us talking about Wisconsin as being a hot zone or things blowing up.
There were some questions about Milwaukee, but generally no, not like New Orleans, not like Chicago, not like Detroit.
Right. So for all the attention to the protests with Governor Whitmer in Michigan and everything going on there, you go and look right across the lake, and very big lake, by the way. No one's swimming that anytime soon, especially this time of year. And you see that they're in the high. So Governor Evers is not opening up Wisconsin anytime soon. If a national chart like this has just been put out, but this is a new variable. This is Wisconsin now is for a critical state, not just because the people there are great, but also because of the 2020 ramifications. You have a blue governor. How is he going to react and implement or not implement things with President Trump laying this out? But I want to go back to the point, make sure we don't miss this. So the gating criteria, symptoms. Makes sense. Metrics there. We understand it. Downward trajectory. We can figure that out. Cases. Steve, you highlighted the absolutely critical downward trajectory of positive tests as a % of total tests within a 14-day period. This is okay. We can figure that. And these are like Sanjay Gupta said. These are spot on. But the hospitals, the infrastructure, and how we're now defining infrastructure, treat all patients without crisis care. And then robust testing program in place for at-risk healthcare workers, including emerging antibody testing. This is where everybody, by the end of business today, when President Trump goes up there for his 5-ish press conference today, this is where everybody is going to go to this one point and say, okay, we get symptoms, we get cases, let's go to this hospital.
Well, they're going to go right there because, remember, let's go back to the calls. They couldn't put together a council, so they went to a series of conference calls to get advice, and that. We know from the one that got leaked the most was the financial one from the U.S. bankers. The entire time was sitting here going, you got to have mass testing. We can't surveillance testing and a contact tracking mechanism either on your phone or, Massachusetts has hired 1,000 people. The number out there for the federal government or for the national is 300,000 to 500,000 trackers, right? My point is they're going to go right to here that, hey, that's a gating item. And the gating item is not just infrastructure or capacity or potential capacity utilization. It's actually the human component of that. It gets back to testing.
So crazy. I know this is crazy. I know the answer ultimately is no. But when you think about, correct me if I'm wrong, aren't all census workers essentially sidelined right now because of this?
Yes, they're talking about the census thing online.
Okay, right. And I mean, who's going to go and do the census thing right now? The answer is zero. I see the commercials running all the time, but the answer
they're actually talking about repurposing some of these census workers to be contact tracers.
Well, and that's where I was going. Yes. Is there not some kind of merging this or repurposing this? That's exactly where I was.
They've talked about it already. Because you got this army of census workers, and they're talking about maybe bumping the census the next year till you get a handle on this thing and turn these into contact. But the point I'm making is that this still hangs up on because you've added that as your part of your hospitals. You've made the units, the nurse doctor teams, as a part of the infrastructure. Therefore, you got to test. And we know already, this is the thing that's concerning, not just about our mass testing, surveillance testing. The antibodies thing's all up in the air right now, right? I mean, what's the latest out of Germany? We're getting very confusing evidence from guys that were at the lead of the antibodies testing.
Right, and what they're finding out, they're getting a lot of false positives, and even more frightening is this consensus that people over 60 years of age don't even produce antibodies for it. And there's a significant portion of people of all ages who, if they produce antibodies, it's unclear if the antibodies are at a level that would actually even protect you in the second or third wave.
To build the longer thesis I'm building, put a pin in that. Because this virus has got a lot of hinky stuff to it, okay? That's another one. People they can't find people over 60 that have antibodies. How does that work? You put the category of why this thing's bizarre, different, changes all over the place. Got guys looking at different areas. The list gets to be a pretty long list. You got SARS, you got MERS, right? You got these other ones. The list is like that. This list is like that. Just saying. I'm just this observation. I just want to list them. Just get them on a page. But there's another thing, and it looks like directionally you've got something either on the testing or antibodies, and it turns out it's not going to be all
or
that.
if you have the antibodies, there seems to be a growing consensus that it will only last for maybe 18 months
yes.
or 2 or 3 years at most.
Note that one too.
Now, here's the thing that jumps out at me as we talk through again, our slides, our influenza-like illness activity level indicator slides. This is all done by state. This is all decentralized federalist approach down to the governors, which I'm not saying that's wrong. I'm just saying that's the way it is. So let's take a look at activity we're seeing today. Governor Abbott, great governor from Texas, definitely running for president in 2024, I would imagine. Definitely. And he'll be a force to be reckoned with. He has a press conference at noon Central today where he'll be, actually it shouldn't have a press conference, he has an announcement because they're not going to have people there, where it's expected he will say, here is the state's recovery plan. And it's expected to open up pretty quick. Right next door, we have Governor John Bel Edwards, still kind of a weird name. Now, they're in the high category, Louisiana, because of New Orleans. He's saying not so fast. He came out and said that yesterday. And so you have these two states right next to each other. You're going to take, now granted, they have different levels, so that's obviously a massive deal.
I know where I'm putting the Texas Rangers. The Texas Rangers are going to go. The real Texas Rangers are going to go right to the border between Louisiana and Texas, checking everybody coming through.
But this is also showing it's going to be a state approach as opposed to a quadrant or a county level approach. Now, it'll then be up to each governor to decide how they're going to do it. You have a state that's much more homogenous, like outside of the Smithfield plant, South Dakota. But Texas, you have massive areas. I mean, you could put like 5 states in West Texas where you might say, hey, everyone go back to work, everything normal, just, have the staggered implementation, as Dr. Burke said, or you can consider your part of the state being, phase 3, whereas, the Houston, Dallas area, you got to be like in
the
phase 1.
Metroplex.
But that's going to really be put it onto these governors.
We said the other day that, I said a couple of days ago, we thought Texas would be the first out of the gate. I think Abbott's going to be pretty aggressive, right? Yeah. I think he's going to be pretty aggressive and roll this thing out and have these bang. He's going to go back and say, hey, I think I meet the gating criteria already. I'm ready to roll. These things may actually start before the end of April. He may just start next week with some small stuff out in West Texas and just roll it out through the whole state.
One interesting thing about this document that they put together for guidelines for reopening is the very last page. It's listed as the appendix. It describes vulnerable individuals. It says elderly individuals, individuals with serious underlying health conditions, including high blood pressure, chronic lung disease, diabetes, obesity, asthma, and those whose immune systems are compromised, such as by chemotherapy for cancer or other conditions. That should be on the top page. This should have been what we were telling the American people from day one. I'm a little bit shocked to have them come out and say, now we're going to protect the vulnerable. This should have been the objective from day one.
I think that's a good point, Jack, because it is slide 26 out of 26.
Yeah.
And it's the only appendix slide.
Right.
It's literally, and it's 2 sentences. It's 1, like Jack just said, elderly individuals, and then 2, individuals with serious underlying health conditions, goes into high blood pressure, chronic lung disease, all that. But it's literally, it's the only thing. One of the things we talk through, and Steve, I'm not sure if we'll necessarily go through all the different phases, but what I did like, what they did here, is specific instructions for individuals and employers, and then specific types of employers. And I thought that was helpful because just to go and chunk it out so people are looking through so let's just take the phase 1, for example, just real quickly. Vulnerable individuals, shelter in place. When in public, maximize physical distance, avoid socializing groups of more than 10 people, minimize non-essential travel. Next slide, phase 1 for employers, consider special accommodations for vulnerable populations, encourage telework, return to work in phases and minimize non-essential travel. Now, I was talking to one person who works for a big Fortune 500 company who, as this was starting to ramp up before everything shut down, they'd been split up into, one was going to be the green team, one was going to be the gold team, and they were going to stagger it and do that. So that's basically saying as people return to work, they're going to start, whether it be people alternate days, they alternate weeks, you're going to see a lot of this. But then the specific types of employers in this phase one, schools remain closed. Senior living facilities visits should be prohibited. Large venues still go under strict physical distancing. Gyms can open. Oh man, as if I ever use
that business is a bigger write-off than the cruise business.
My once a month that I use my Gold's gym membership. That's going to go down to zero.
They're going to be the new sponsors of the War Room.
Yeah, exactly. And the elective surgeries can resume on an outpatient basis. So they do go. I did like how they chunked this out. I think this was smart messaging.
We want everybody. We got it up on the site, but I think everybody at home should download this presentation. You owe it to yourself to go through it. They didn't have enough time yesterday in the presentation to actually go through it. You should go through it. Hashtag War Room Pandemic. We want to crowdsource this. Give us your observations on the presentation, your questions. We're going to return to the War Room in just a second.
I'm Nick Bolton, and these days...
Hey there.
Hey there. It seems everybody has a pair of tactical sunglasses.
Good morning.
Morning. But what if you're already...
Pandemic. Here's your host, Stephen K. Bannon.
Welcome back to the War Room, episode 124 now with over 6 million downloads of the hottest podcast. And by the way, a podcast that's this hot, and you get it ubiquitous. We're everywhere. John Fredericks, we're on radio all over the country. We're on streaming services. We're on Dish 219. We're on Newsmax. We're throughout the known world in English language. Shortwave radio, medium wave radio, AM stations all over the country. We get inundated every night with response from those folks. And our biggest distribution is actually Mandarin. And we're subtitle in Mandarin, and throughout the day, later in the day, after subtitle, G News and GTV put it up nonstop, and we get tons of great comments. It's the reason we got the idea to do the Wuhan special. We announced the Wuhan special 2 days ago. Bingo, Chinese Communist Party, upon further review, has now said that maybe we're double the number of dead. The Chinese Communist Party murdered hundreds of thousands of people in China. We're going to get to all that on tomorrow's special. Now, here's the interesting thing. President Xi says it's a demon. We cannot let this demon hide. President Trump, basically what you're saying, his thing is nothing's inevitable. When you cut to this chase, and the reason we've taken this hour to go through in detail the presentation, what is the president's actually saying for most of the country? And I say most of the country, 90% of the country, except some mega hot zones in the tri-state area, in New Orleans, right? Maybe in Detroit, maybe in Chicago, and some that we're going to get to who the heroes were here. But besides that, Jason Miller, Jack Maxey, Raheem Kassam, what message is in that presentation when we can open the country back up?
I'm looking at this again from just a purely objective basis. When you look at the way that these the 3 flu weeks are laid out, or the flu-like symptoms, the way that you look at the gating, both the empirical part that you can measure as far as on the 14 days of decreasing, and then you get to the end when they talk about the antibody testing and things like that.
It's just got to be robust.
Robust. In emerging. I mean, robust and emerging, my appetite is robust and emerging. That's not exactly, we can't exactly quantify it. I'm looking at this.
That is Steve Bannon and Jason Miller in the sun and said, let's put robust and emerging in there. That covers us, doesn't it?
I'm looking at this saying by Memorial Day, everywhere in the country except for the tri-state area and maybe 1 or 2 other pockets are back to normal at the latest.
Do you guys agree with that?
I think there's a very good possibility that's where we go.
Well, I'm not saying it was where we go. I'm saying the message of the presentation yesterday was, I think, that given all this, if you look at in this criteria, and if you look at and it's to the governors, and we're not saying you have to have mass testing. It's going to be to the governors, but these are the areas. I think you do get someplace in the next 45 to 60 days. Right, that outside the tri-state area, you could be in New Orleans. You could be ripping on this thing. Do you agree with that, Raheem?
Yeah. Look, firstly, I had to look up Memorial Day being non-American.
right.
But now I've looked it up, and I understand it.
Right.
It's not like Boxing Day.
Right. Exactly.
You think after the 15 years you've slipped in here with no visa that you would know what Memorial, you know where
you're gonna have the front door bashed down.
Just saying.
Just
right.
for the record, I have a very robust and emerging visa.
Remember, I'm still a nationalist. What is he doing here? How does he work?
But that does seem right, by the way, barring any major complications. But the question is, there may be some major complications. We'll get into the international stuff in the next hour, but there are obviously places and cases and smaller towns and local data that we're getting now where you are seeing little upticks.
Why didn't the president and the team put a critical path on like slide 10 and lead at that and say, by the way, of what we're saying, and put the appendix up front, because we're going to somehow sequester the people most vulnerable, the elderly, comorbidities, some minority groups, right, that don't have maybe the healthcare system delivery, and get to a critical path and say, bang, by Memorial Day, guys, we think we can get started. In Dr. Fauci's, it's going to be a long time to get back to normal and all this kind of stuff is put into perspective of, but we can see the sunlit uplands because we're starting on that path, start no later than Memorial Day.
So, and to that point, I want to go back to you again. So we're not looking at just the media. We're not looking at just the White House, for example. Dr. Scott Gottlieb, former FDA commish, he was on CNBC earlier this week. I think this was Monday.
Yes.
Pretty sure this was Monday.
Yes.
Listen to what he says about timing coming back to this testing issue.
I think the timeline is what we've been talking about. I think we're going to see continued improvement through April. Different parts of the country are going to be coming out of this earlier than other parts of the country. And in May, we're going to be looking at opportunities to start slowly reopening aspects of the economy. And so through May, I think we're going to slowly start testing this. I would say, at some point in mid-May, you'd want to see a couple of weeks of sustained reductions in new cases before you start contemplating restarting businesses. But certainly by May.
So it's mid-May, Memorial Day. Right, I think, and hopefully today, maybe, if I was the White House, I'd put the critical path up there and say, hey, this is we think the inflection point for the takeoff is sometime between mid-May and Memorial Day, and hey, let's go grab it for the summer and just get on with this thing.
If I were governor and I was trying to see like a soft open, see how we go, the very first thing I would do is send the children back to school. Get them back to school, get them learning again, maybe run them through the summer.
Do you think Abbott is a good tell on this today about what he decides to do with the Texas public school system?
I think it will be a very good tell, and I hopefully if he does open them up, I hope that other states follow. I mean, we are keeping these kids a year of education out of their futures, and who knows what the cost of that will be for the country going forward.
Okay, you want to jump in here, Raheem?
No, but I do have plenty to say in the next hour.
Yeah, no. So here's here's what we're going to do. We're going to start the next hour. We got all international. We got CCP. We got Lou Dobbs is joined us going to war with the Chinese. We got a whole bunch of stuff in the second hour. However, I do want to. We don't have enough time to do it now. I want to come back, and in the second hour, I want to start off with the unsung heroes in this. Besides the doctor nurses team, what kept them alive is still the therapeutics.
Absolutely.
The therapeutics has not been reported correctly. And the reason is it got politicized. President Trump liked it. Obviously, the mainstream media is not going to like it. It actually is. It's the reason the market's up today. It's the reason that I think in Miami and some of these areas, but the senior places, you're seeing it. You're seeing it in the state of Washington where people applied this, did it smartly. In New York City, the casualty rates we don't see anywhere near the doctor-nurse teams. Death rates you saw in Italy, which I think it got up to 8-10% at one time, right?
And this is the human agency of a free people and doctors using their own best decisions.
This is still what the system we got, as flawed as it is, still the doctor-patient relationship is the key relationship. Alfredo Ortiz and the guys at Job Creators Network drilled that one into me. Okay, short commercial break. # War Room Pandemic. We want you into these slides. You got to nerd out today because you're helping the country, not just the president. You're helping the country get through this. Give us your comments, your observations. Back for the next hour in a second.